Empty of patients for more than 6 months, London's huge Nightingale hospital is preparing for reactivation, a contingency emergency planners have requested as the capital's hospital trusts struggle with a huge surge in COVID patients. NHS staff we've spoken to say the situation in many hospitals, particularly around London and the south, is increasingly desperate, with exhausted doctors and nurses inundated with more COVID patients now than at the peak of the first wave.
What's happening in our critical care unit now is that the demand for those beds is outstripping the supply of medical staff. So it means that where normally we would have one ITU nurse for one patient, often at the moment we've now got one ITU for 2, 3 patients, and that ratio seems to be getting larger. I mean, I've got 38 years in the NHS. I've got 21 years in critical care. I've never seen anything like this, and it looks like it's shaping up to be much harder than the first wave.
Only 2 Nightingale facilities, this one in Exeter and another in Belfast, are currently still treating COVID patients. Any move to fully reactivate the others raises obvious questions over staffing.
How we're going to manage to open Nightingale hospitals with our existing staffing is a really serious question, and one that really needs to be answered by the government. How exactly are we going to staff these Nightingale hospitals?
Are staff just now completely exhausted?
They are, and I can't overestimate that enough. They are absolutely on their knees now.
Even more alarmingly, health professionals say the peak of infection hasn't even hit yet, with a further surge in cases expected from those groups who've mixed over Christmas. And they're appealing to the public not to break the rules this New Year's Eve. Mark White, Sky News.